the pinnacle of the report is that there is no overarching government policy or action plan. It talks about a lack of integrated service. It talks about no national policy for suicide prevention, and no formal mental health budget, and a lack of coherent leadership. These are not small issues.
I've tried to arrange with the hospital for a constituent to be accepted in Ocean Views. The constituent goes to Ocean Views. Ocean Views knows nothing about it. I get a call. The constituent then wants to commit suicide because he hasn't been heard. I have to turn up at Ocean Views, stick the constituent in my car. People want to know when they're going to be supported. People want to know when they're going to be seen in Bruce's Farm, which has lost 2 doctors in charge of drugs. People want to know how much aftercare they're going to get.
There is one additional person who is a public health professional who is an additional resource to the teams.
Hired specifically to
specifically engaged through the Ministry for Health to specifically prepare a roadmap to give effect to the recommendations of the report, set into the context and today's needs, and looking at things which at the time may not have been raised in the report. For example, one of the things that I have specifically asked her to prepare for me as well is a mental health support report post-COVID, and that is part of our Restart and Recover strategy.
Anxiety, panic attacks, just not feeling well, feeling low, feeling blue. A lot of us would say it's part of life. So a lot of this can very much be hidden. What comes then as a presentation into the health services and primary care, into mental health services, may just be a small part of that.
It's an uncoordinated service, it's a fragmented service, and I speak on behalf of many service users that I know, and myself as a relative of a service user who was in the system for decades, until she died last year. And I know exactly what the system has to offer and what it doesn't. And much of the time, it's a battle. And that's what people keep talking about, that they have to battle to get what they want. And this is not what the system should be.